the Toronto Star, I'm Saba Itazaz, and this matters. Even as healthcare workers were being hailed as heroes as they fought one of the deadliest pandemics of our time, many of them also faced this terrible irony. They were getting death threats while saving lives. It took a public health crisis to bring it all to the surface. The things we didn't want to see or weren't comfortable talking about in Canada. From the stark inequality of who got the most hurt by this pandemic to a growing polarization in the country from disinformation campaigns, conspiracy theories, and an anti-vaxxers movement. All seem woven together by this uncomfortable truth. Racism, xenophobia, and misogyny are alive and well in this country. There has been a disturbing rise in digital harassment and hate for those on the front lines of this pandemic. Healthcare workers advocating vaccines, scientists helping disseminate the data. Anyone who is vocal on social media finds themselves on the receiving end. Doctors are getting death threats. And now on-screen has merged into IRL as throngs of anti-vaccine protesters gather outside hospitals, blocking entrances, endangering healthcare workers and their patients, a lot of whom are the unvaccinated. Dr. Naheed Dosani is joining me now to talk about the nightmare that's been the last 18 months for those on the front lines of the virus and the vitriol, and what needs to happen next to protect them. Dr. Dosani is a palliative care physician and health justice activist in Toronto. Hello, Dr. Dosani. Thanks so much for joining me on the podcast.
Thanks so much for having me on.
First of all, it's just really ironic that we're having this conversation today when I was just looking on Twitter and I was seeing that another one of our journalistic colleagues is actually shutting down their social media because of the constant harassment. And I can only imagine how this is sort of doubled in intensity for healthcare workers. I just want to start off with, are you doing okay?
Well, I really like the start of this conversation. It's not every conversation that starts like this. And, I'm doing okay, and I'm doing better than okay because we are having conversations about the experiences of health workers across this country and what they've gone through throughout this pandemic. I think, it goes without saying, this has been a marathon, and this marathon is not over. But at the underbelly of the experience for health workers has been, this. We started with banging pots and pans to celebrate our health workers. And as the pandemic went on, the amount of hate that we have received in our inboxes, our social media accounts, the letters we receive at our offices has increased to a point where it's really spiked, to a point where, colleagues are receiving death threats, violent attacks, racist threats, misogyny, xenophobia. And it's really culminated into a very challenging experience for health workers at a very challenging time.
We've definitely seen this shifting and escalating over time. Can you talk to me a little bit about what are some of the forms of workplace and digital violence that your colleagues are and you are struggling with? I know that it's not just the digital aspect of it. There's protests, and also people have just kind of reached this maximum frustration and stress point. And I'm being told there's, confrontations inside the hospital with family members even sometimes. Is that correct?
Yeah, I think what we're seeing is a continuum of responses, which can include replies and comments on social media platforms to direct messages that are vulgar, very specific. I had someone send a animated photo of them spitting at me, to racist attacks and misogyny, to actually like long threats and violent attacks over email, to our work emails, and even having colleagues and I receive letters at our place of work through the mail, and actually, believe it or not, through our fax machine, which are tweets kind of with handwriting, threatening us. And then to another point, yeah, absolutely. You can't have this conversation without talking about what's happened, over the last few weeks and months, the protests outside of hospitals by the anti-vaccine community. And yeah, this has created conflict outside of our health spaces, inside of our physical health spaces, on social media and on the internet. So it's a continuum, and we're seeing all of it.
Naheed, as you talk to me about how you kind of saw the environment shifting as COVID began till now, has the hostility increased? Have you sensed that?
I just want to say there's always been an underlying level of hate that has existed online for health workers, particularly those who are speaking up and standing up for science and justice. But what we have seen is an uptick in this hate and a spike that tends to happen at times when, for example, our governments make decisions that stand at odds with science and when they do not stand in solidarity with health workers. So when the Ontario government announced that they would not mandate vaccines for health workers, this really emboldened people who believe in anti-science rhetoric and the anti-vaccine community. And we noticed a huge spike in hate and attacks at that time. And so, I just want to say there's this underlying hate that always exists and then it tends to spike up from time to time.
And also the sort of polarization we've seen in the political climate. Do you think that also plays a role that's tied in?
Yes, I think it's multifactorial. I've already talked about how when governments don't stand with health workers and science in their policy decisions, but it goes far beyond that. I mean, I do recognize that many people have experienced financial loss in our communities due to the pandemic. And anytime a health worker speaks out about, potentially COVID precautions or the potential role of restrictions, it can really anger people and it fuels anger. So I know that there's a resentment out there towards those who are standing up for science in that way. And then I also think that anybody who's just prolonging the pandemic in any way through anything they say may actually, upset people because people just want this to be over. So I think through an empathetic and compassionate lens, I can actually see where people might be getting upset and angry, but it's never okay to throw vile attacks at people, anybody, and never at health workers, particularly because health workers have been so important during this pandemic and will be so important to keep them safe and happy and healthy to get us out of this pandemic.
And it's very generous of you to look at it from that lens as well. And it's obviously so interconnected. The impacts of COVID-19, we've seen them disproportionately so on the most vulnerable. And sort of this health crisis has amplified the inequity and the structural issues as well. And I know from following you on Twitter that you speak out about the science and the social justice aspect as well. Has this been a bit of a double whammy for you?
Oh, totally. I mean, on the COVID-19 side, it's not just a medical or, science issue. COVID-19 has been a social justice issue from the very beginning. We've seen the disproportionate impacts of this virus on racialized communities, low-income Canadians, people who experience homelessness, essential workers as well. And social policies have had a huge role in who's been affected and who's not, who has a home, who has paid sick days, who has, precarious work. These are the people who have been more likely to be affected by COVID-19. But as a health worker who's racialized, there's also different layers of vulnerability to the hate I'm getting. There are layers to the hate that we receive. So, while many of my white physician colleagues receive hate, the kind of hate that I receive tends to be focused on xenophobia and racism, about me being a person of color. My Muslim background, for example, comes up a lot. And then for my colleagues who are female physicians, they deal with a lot of misogyny as well. So recognizing through an intersectional lens, there's different kinds of hate that we're receiving across the board.
And we're talking about all of these layers on top of this collective mental toll of dealing with what you guys dealt with during the peaks of the waves of this pandemic, the overflowing ICUs, and working directly in a way with the tremendous sort of human cost of this. How has this impacted you and other colleagues emotionally, mentally, even physically?
Yeah, it's a great question. You got to remember that colleagues across the country who've worked on the front lines of this pandemic have been pulling double shifts, working overtime, working extra weekends, taking on extra leadership roles. And there's nothing worse than, taking on this extra work, in times of crisis and then ending a shift and looking at your email and seeing a threat sitting there while you're just trying to serve humanity and your neighbors the best way you know how. This has led to significant moral injury and significant compassion fatigue for people. Many health workers are stressed, feeling distressed, they're grieving, and many are bereaved because we saw an immense amount of suffering on the front lines of this pandemic and had to make great sacrifices to do that. On the flip side, I'm super hopeful for the future because the health worker community is more connected and tight-knit than ever before. We have gone through this collective trauma, but we have collectively been resilient through it. And I think that's something that we need to celebrate as well. And I think it's part of the reason we've been able to get through it. And I think of many colleagues who have made great sacrifices and have always been there for me, no matter what they've gone through. And it's just being there for that extra conversation, that extra bit of support that goes a long, long way.
We'll be right back. And And we thank you all for your work. You're obviously continuing with that. And I see you still having very outspoken views and opinions and, providing us with valuable insight on social media as well. But, at times when the harassment has been particularly bad, when the targeting has been particularly sharp, have you ever sort of thought twice about it or sort of felt like you had to self-censor something that you were going to post?
Yeah, there's certainly been moments where I've received violent attacks, been called names, insulted, threatened, and I start to think like, why am I doing this? Like, why am I putting myself in this position? And, there's been times when I've just gone kind of dark and I haven't posted anything because I'm reflecting and it hurts. Like it takes a toll on you. But then I start to also realize that there's great power in healthcare to heal people, even if they're feeling sick. We have the power to really heal people and collectively have the power to heal communities. And I'm a firm believer in the power of healthcare to inspire social change. And it's that hope and optimism that keeps me going and keeps me, connected to the social justice issues that this pandemic has brought up and undoubtedly will continue when this pandemic is done. And so I think taking that compassion and empathy that we derive at the bedside and taking it to the large public policy scale to really check that thermometer, that moral compass, that moral temperature in our society to say that we can do better, we need to do better. That's what drives me to keep posting, keep speaking, and keep standing up.
And that's such a big responsibility, and it's such a heavy burden to be carrying through everything that we've seen through the last 2 years. And there must have been obviously some kind of impact. We're now talking about severe labor shortages in the healthcare sector. So do you feel that this constant toxicity as well was playing a role in that?
Yes, I think the toxicity that health workers have been experiencing is playing a big role. I've talked to colleagues who say, we're dealing with COVID-19 in our days, and then at night we have to go battle people on social media platforms to fight for science. And so it's a 24/7 kind of thing, and it never seems to stop. So that has certainly led to morale issues and has made it harder for people to be compassionate. But at the same time, we've seen thousands of people die in our long-term care facilities here in Ontario. We saw the disproportionate impact of this pandemic in racialized low-income communities. And we know that our governments did not and have not always made the right decisions to support the health of people and support the best way out of this pandemic. So it's our moral obligation and duty to speak up and to stand out. And that's why so many of us continue to do it. But yeah, it's because we saw that suffering. That's why we do it.
Do you see a link between the way we've seen the anti-vaccine movement kind of gaining momentum and the increase or intensity of the antagonism and the threats that you and your colleagues have received?
Yes, the rise in misinformation and anti-science and anti-vaccine rhetoric online is very much intertwined with the hate that many of my colleagues in healthcare are seeing and experiencing. I also think that it's important in conversations like this to talk about how the online hate that we're experiencing is also intertwined with white nationalism and the rise of white supremacy. We often think that these issues are issues that are present in the United States, but no, they're actually happening here in Canada too. And COVID-19 has proven that that's true. And that's why it's so crucial we have more conversations about how to address online hate and really get at the core of what's going on here, because it's much more sinister than a few people sending some, messages to doctors online. There's a coordinated move here, and it's a large issue, and it needs to be dealt with.
Yeah, and I think everything that we've seen over the past 2 years happening with journalists, with healthcare workers, with others, I think it would be very counterproductive for someone at this point still to say, no, this doesn't happen in Canada. This is very much a discourse that is taking place in this country as well. Let's look at the big picture. What are the implications of this kind of continued and sustained harassment for the future of the healthcare sector itself?
Well, at a very basic level, if we continue to see health workers having to deal with their clinical work in their healthcare settings and then having to receive hate at the same time when they're off work, we're going to deal with a whole set of health workers who are just basically dealing with burnout. And we're not going to have enough health worker expertise or health human resources to meet the needs at a time when we really need the support of health workers. We're trying to get out of a pandemic. the other thing is you may start to see shifts in where people are working and the kind of work that people do. You might see a brain drain that exists, people moving to different sectors. I also think it may lead to, you mentioned a journalist colleague who would actually, turn their social media account to a private account. You might actually see colleagues who may fear speaking out because they are worried about their personal safety and worried about physical and digital violence. And that's unfortunate because the perspectives of health workers, like the perspectives of journalists, are essential to have out there to continue to support the health of Canadians, but also to support the social justice needs of Canadians, to make sure we're meeting every person where they are at and with what they need. So I think those are some of the ramifications that could occur.
And we've seen so much disinformation and misinformation and, conspiracy theories and paranoia cast towards healthcare workers. How do you see this impacting the relationship of trust that's so important between healthcare professionals and the public, which is already fraught when it comes to racialized communities?
To start this discussion, I want to say at the outset that the vast majority of people are vaccinated. And so I think we need to celebrate that. And that, when we're having this conversation, as part of it at least, we're talking about a very small group of people who are unvaccinated potentially and absolutely have mistrust of the healthcare system. And I always talk about the unvaccinated community as probably a continuum of people. There are absolutely those people who are anti-science and are, spreading misinformation and anti-science rhetoric and are very loud, but they're probably a very small group. There are many others who are unvaccinated more for structural reasons, mistrust of the healthcare system due to systemic racism, mistrust of the healthcare system due to trauma that people have experienced in the healthcare system, or simply people who are just, working multiple jobs. Maybe COVID-19 hasn't hit them in a way that it's hit others, or perhaps, people don't have access to childcare, like really, structural reasons. And that's why we need to recognize that not all people who are unvaccinated are necessarily the anti-vaccine protesters we talked about that were outside of, hospitals a few weeks and months ago. But there are many people who just really need an empathetic and compassionate conversation. This is going to be hard work to reach these people. We need to roll up our sleeves, really get our hands dirty, really connect with people, really build trust and rapport. And that's the only way we'll get there.
In terms of solutions, we know that after his summer re-election, Prime Minister Trudeau told people in September that there would be prioritization of laws to protect healthcare workers from this kind of harassment and intimidation. And I do know that before the elections, even Bill C-36 was proposed to criminalize harassment of healthcare workers. Do you think that any progress is being made on that promise and that legislation? And is that enough?
For sure, we need formal conversations about what needs to be done, and something definitely needs to be done. At a very basic level, again, I think the first thing that our governments can do is make policy choices that stand with science and in solidarity with health workers. And we have not seen that, particularly at the provincial level here in Ontario. And every time that happens, whether it's, not mandating vaccines for health workers or announcing that there's an expiry date for proof of vaccination at restaurants and bars, it emboldens the anti-vaccine community and emboldens people who spread misinformation and hate to say that this is okay. Then I think we do also need a conversation about online hate and a national conversation, not just towards health workers, but people from all walks of life about why this has spiked and the kinds of people who are dealing with these targeted attacks. And this has to encompass policymakers, like people who create the law, people who are experts in these kinds of things that can then guide us through, absolutely the kinds of legislation that we need. We absolutely need, new criminal sanctions for anyone who blocks access to vaccine clinics, hospitals, testing centers, abortion clinics, and make sure that, it is illegal for anyone to intimidate or harass healthcare workers. I know that the Liberals and the NDP have supported this federally, and I recognize that this is something that needs to be brought to the forefront. But I also think about, social media companies and corporations and how we are asking of them to be accountable to this. Because I know some platforms are better than others. And I think nationally, our federal government has the opportunity to, really pressure our social media corporations that are making, millions and millions of dollars of profits off of us to be more responsible to the hate on their platforms so that we don't have to deal with the hate, to be more responsible to misinformation. And I am talking about Twitter, and I am talking about Facebook or Meta, whatever it's called now. And I think it's time that we address that.
That was really insightful and definitely thought-provoking, a conversation that needs to be had again and again. Thank you so much for your time, for all the work that you do, Dr. Dosani, and my solidarity to you as well.
Thank you so much. It's a real honor to be on the show.
I was speaking to Dr. Naheed Dosani, a palliative care physician and health justice activist in Toronto. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Adrian Chong, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattington. Our music is by So-Called, Mike DeAngelis, and Sean Pattington. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribing matters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.